Welcome to the Public Health Roundtable. I'm Dr. Huntley, and I'm your host. I'm joined by some amazing panelists here as I'm all giddy about introducing them. It's going to be amazing, and I'm excited that everyone's here. So just in case you were wondering or you've been out of the loop, this is actually National Public Health Week. And as public health professionals, this is our 1 week we can shine and be in the spotlight any time of the year, but this is 1 week when it's ours to own, and it's really been exciting. So National Public Health Week's overarching theme, I'm looking at some notes here, is for this year, centering and celebrating cultures in health. And that's what we're going to talk about today. We're going to share with you our perspectives of what culture and health means in our view and in the work that we do. So before we dive into the topic, let's do some introductions. Let me officially introduce myself. Like I said, I'm Dr. Charlotte Huntley. I'm the host of Public Health Epidemiology Conversations podcast. We have a brand new episode every week. We started back in 2017. And I'm also the CEO and founder of Dr. C.H. Huntley, which is a public health consulting organization where our primary mission and focus is to work with large nonprofit organizations, because these are those community-based organizations that are targeting various communities and niche groups. And we support them in explaining their health information that's typically a little complicated and technical, but we help them really express that and explain that in plain language to the communities that they serve.
Okay. Hi, everyone. My name is Andrea Lowe. I run my own consulting business called Social Impact Studio Consulting. And my goal, or our goal, is really to work with health and human services, nonprofits, and government agencies as they work to obtain and meet their strategic planning and service delivery innovation goals. So I look forward to talking a little bit more about my work and how that connects with cultures and health.
Hi, everyone. Thanks for having me. My name is Patrice Sirmons, and I am a public health consultant. I'm also a registered nurse. I am also the principal consultant for PSD Consulting Group, where we work with community-based organizations, nonprofits, and provide services such as strategic planning, community health program development, and do that in order to improve health outcomes and decrease health disparities.
Good afternoon. My name is LaShonda Richardson. I am also a public health consultant and the founder of Emerge Public Health and Community Development, where our mission is to educate, motivate, empower, restore, grow, and evolve. And within Emerge, we work with individuals, we work with community organizations, and we do work with them to help to promote health equity and reduce and eliminate health disparities. And we help to access, to plan, and then to execute, and to help them achieve attainable goals to reduce health disparities.
Nice. All of you are doing such amazing work. I get excited every time I know you all, but I just love to hear it and just be reminded of the work that you're doing because it's so important. Let's transition into this topic. Like I said, this overarching theme is celebrating cultures in health. And I like that they use celebrating. I think that as I prepared to, kind of discuss what this means to me, I thought about cultures. We could probably spend all day just defining cultures. There's so many nuances, just in the definition. And, on a very high level, think about cultures as, sort of the customs, the arts, the social structures and institutions that are really a part of a particular population or group of people. And that's really broad and vague. For me, I'm going to think about in the discussion today, the culture of the South, because that's really been kind of near and dear to my heart lately, especially as I've been working with a lot of organizations, specifically with communicating this health information, like I mentioned earlier. And some of the challenges that they're facing, really kind of the root cause is in the disconnect with the communities that they serve. So they meaning these leaders of large organizations, can have the heart to serve a community, but if they're not really involved and really know the community, have a relationship with the community, then there's always going to be that disconnect and there are always going to be challenges. So when it comes down to the South, which is really where I'm really targeting, and I live in the South. I live here in South Carolina. So for those of you that are joining us, different parts of the world, this is the South, sort of eastern part of the United States where I live and where I'm really referring to. And there are a lot of cultures, traditions here. You know, there's hospitality. You know, we're known to wave at everybody, whether we know you or not. You know, if you drive by somebody in the neighborhood, you tend to wave. That's just what you do. And then there are a lot of religious traditions that are really a part of the South, you know. So when you start thinking about that and you think about any of the different subgroups, it can mean something different. When it talks about food, you know, we talk about, I started drinking unsweetened tea years ago, but I can tell you, if I go into a restaurant and order that, 9 times out of 10, I get a really odd look. They're like offended that I've ordered unsweetened tea. You know, there's a lot of sweetened, you know, fond memories and things I could talk about with lots of delight. But at the same time, you know, the South is, you know, known for like roots in racism, you know, systemic racism, colorism, you know, and trauma that stems from those historical contexts. And that adds a layer to cultures, you know, so there's just a lot of nuances. So as I really put my heart into working with nonprofits in the South, you know, and especially the Southeastern region here in the United States, I'm really aware of these different nuances. And for me, it's about keeping that awareness, realizing there's always something to learn. If, you know, within any culture, if you pick a subgroup, there can always be more branches to learn. You can't just say, oh, the Black people in the South, and think you've got it down because I'm a Black woman in the South. There's like, that can go in so many different directions and be so many different subpopulations. So I think when it comes to culture and health, we really need to be a part of, you know, the culture, meaning we need to understand, be open, understand that we're not going in telling someone what to do and how to do it. We're going into partners. So that means we need to be, you know, receiving and wanting to learn and participate. And I've seen people do this really well. And I've seen people really, some well-intentioned, but just mess it all up.
Yeah, I was completely resonating with what you were saying, Dr. Huntley, because I've grown up in the South. My family's from the South. So the sweet tea thing is definitely there. And I remember moving to California where there's more flavored teas and not so much sweet tea. And I was very confused about how to go about ordering my drinks. I think I stuck with water. And just thinking about this day, like as well, like culture, how multifaceted we are when it comes to culture. Like when I was trying to think of like culture should I speak to more specifically, it was really hard to choose from because I have like Southern roots. I'm also American woman. I'm a Christian as well, in religious culture, and so there's a lot that was playing in my mind. For me, I was thinking of talking a little bit today and connecting with rural culture because I live on the top of a mountain in a really rural area, and I really love it here. And I know there's a lot of expectations and assumptions when it comes to rural communities and rural populations, as well as especially when it comes to access to healthcare and strategies when it comes to health. And there's lots of benefits that are within these communities. I know for our community, there's a strong desire and support to help each other out. Last winter, we had a pretty bad winter. And for us, we have a pretty large yard and but we don't have like all the heavy equipment to like do the snowplow and everything, but our neighbors do. And they just showed up and like helped us get out of our driveway unasked. They just saw us trying to do this on our own. And it was just so wonderful and helpful. And when I think of like access to healthcare, one of the, I guess, kind of like negatives, I guess, that you think of is like, let's say when you need emergency services, when you need to get to the ER, my closest ER is close to an hour away from my house. And that's like no traffic. That's literally miles. So getting to the ER in a quick manner isn't possible for me. But our communities have set up our volunteer fire departments, our local EMS services that really fit in and support those emergency health services for us. And they're such a boon for our community, as well as a social connection for us as well. And so there's all these great benefits, and that unless you live in the community or connected with a rural community, it's hard to know of.
With cultures, there's so many dominant cultures, and there's all these subcultures. And I'm actually on vacation right now in Amsterdam, and that culture of being an American is dominant. But when I'm at home, it's Black woman, and then nurse, and keep going, and so on and so forth. But when I think about cultures and health, I start to think about health disparities and the health inequities. And even as being a Black woman who is formally educated and socially and environmentally educated, and I reside in Cleveland, Ohio, which is basically flooded with healthcare providers that people come to see from all over the world, but yet I am still more likely to have poor health outcomes because of that culture of being that Black woman. And then when you start to look at all these other subgroups of people who experience these health disparities, you're looking at, racial and ethnic minorities, women when compared to men, people who identify as LGBTQ+, and then geography, as you mentioned, with rural. So looking at it from the nurse standpoint, and also as a public health professional, I start to look at culture of healthcare as an access, and seeing that we need to possibly shift that culture and make it more of a community. It's going to take a village to address these health disparities. And that we have to stop thinking about healthcare as being the four walls of a doctor's office and a hospital, because that's sick care. That's where you go where it's hit the fan or it's about to. So when I think of culture and that subculture of me being a nurse and a public health professional, I start to think of, let's take it to the community. Let's start to have these community programs that, for example, I live in a very urban area, and we have a plaza that I'm sure anybody who lives in an urban area may have, that has the nail salon and the rib joint and my Aldi's grocery store. And what if we put like markers down on the sidewalks or on the storefronts to say, hey, if you walk this amount of time, you can get in this many steps. So that's what I mean by taking the village. So instead of saying, hey, 20 minutes for your takeout, yeah, it'll be 20 minutes, but a lot of people can do about 2 laps and get out and do things. So that's what I think about shifting to health and making it more of a community effort in the village.
So I've enjoyed listening to all of your points, and I too am from I'm from the Carolinas. I'm from North Carolina, so I really understand when you're talking about the traditions and everything like that we have from the sweet tea. And I heard somebody say something about a rib joint and stuff like that. So we do have a lot of traditions in the South, and when I'm working in the community, I'm usually working with the African-American community and with that culture. And what I've seen is that we really, when we're talking in different cultures, not only that one, that's mainly the one I work in, and that one in communities of color, but that we're really speaking their language. And I think a lot of times we go in, and Dr. Huntley, you talked, as you know, some people do it very well. And I think sometimes we're kind of like giving information and things of that nature. But, are we evaluating and seeing if people are really understanding and if they're really practicing or putting into practice the information that they've been given in the communications that we're giving? So I think that's very important when we're working with communities of color and we're working with the African-American community and trying to reduce those health disparities, just making sure that people have a clear clear and concise understanding of what they're being told and what they're being taught. That goes from the community, and also when you're going to see your practitioner or something, just having that conversation just to say that, it shouldn't just be a one-sided conversation, making sure that if you're being given the results for your blood test or anything like that, that you really understand like what that means, that you really understand and that you're asking the right questions. Because I think that when we understand, when we know better, it's kind of cliche when we say when we know better, we do better. But if we have a better understanding of what may be causing the disparity, it gives us a better opportunity to change it. That's one thing, one barrier that I see that I challenge, people, us that work in public health and even practitioners, is just having that measure of making sure that we're communicating clearly and that we're making sure that those things are understood, because we see that a lot in the culture. And yeah, that's what I see a lot in working in the community and trying to help to reduce those disparities.
As I was listening to all of you, I was thinking about something interesting that kind of surfaced, as like Patrice has given an example of like walkability and, if you walk so many laps and how many steps and what that means. And it just points, even as we're talking about the different cultures, like for someone in Andrea's community, that's not going to matter because they're not going to be thinking laps and, because there's not really the walkable communities and you're not, getting deliveries necessarily. And so that's just something that comes up. And it's just a great example of what happens with a lot of the organizations that, we partner with and work with, is they will take something like a toolkit or a template from some larger source. And this is great. And yes, it's maybe a validated tool and it makes sense because these are really important, the walkability steps. Yes, this makes sense, but does it fit the culture, of the people serving? Is it, does it relate to them? And those are just things that we have to constantly keep in our minds, right? I'd like to go back and just hear from each of you if you have, any additional thoughts, takeaways, anything that you'd like to add as we begin to wrap up and say goodbye to everyone.
I think what you just said, Dr. Huntley, really summed up what I was thinking, was that we have to recognize both as professionals, but also as community members, as people either participating actively in that culture, identifying with that culture, or just connecting with them for whatever reason, that things can't be one size fit all. We have to listen. We have to say, hey, this is what I know, but how would this work here? What do we need to change? How can we really make this work? And try our best to understand each other and understand our cultures and recognize that we're all made up of many, many pieces of different cultures, and all that needs to come into consideration when we do our work.
Yeah, I think you both said it well. There is no one size fits all, and we have to customize our actions and our strategies, and then we also have to implement them. That is sometimes where that fall through happens, that implementation and evaluating it. And I think we all, as public health practitioners, we're all like, you gotta not just talk about it, you gotta do it, you gotta look at it. Did it work? Why didn't it work? So I appreciate that all of your, I get kind of focused sometimes because I am in this urban area and I do think that way. So when I hear about rural, I'm like, oh yeah, we need to change this strategy for them. So I think that's a good point because we tend to think more about culture when it comes to racial and ethnic minorities. And there's a lot of those other subcultures that need to be considered when we are looking at developing services and doing programming to affect the health of individuals, and not just healthcare, but wellness.
I agree with all you with what you all said, and what you just said, Patrice, is very important, that we're inclusive to the subcultures, like, when we're talking about culture and health, and when we're going into the community and just talking to people, in general, that we're relatable, that we're speaking their language, that we are making sure that, they have a clear understanding of what we're trying to communicate and how we're trying to educate. Just making sure, I think Andrea said it as well, that we're listening, because sometimes you know, we go in and we're so passionate about what we want to do and what we want to deliver that we aren't listening. And I think sometimes that, you know, when we listen to understand and not just listening to respond, that we can communicate better, and that they'll have a better understanding. We'll understand their perspective. And then from their perspective, we are able to translate what we're trying to give them, what kind of education or resources we're trying to give them. Yeah, just being relatable, just being inclusive when we're talking about culture and health.
Before we actually sign off, I would love for Andrea to tell us about the sign that's hanging right there in your office.
Okay. Yes. So I can't take credit for the sign, but I was working with one of the organizations that produced this sign, I Be Black Girl, out of Omaha, Nebraska. At the time, I was working for the Nebraska Department of Health and Human Services, and I had actually just started there. And one of the challenges that had been going on at the time was that I Be Black Girl and other community organizations were trying to get past Nebraska's version of the Crown Act, eliminate hair discrimination, particularly among African American women. And it had gone through the legislature, got vetoed, and we needed to work as an administration with the community in order to come across, develop language that could get passed in this following legislature. And so had the great opportunity to work with them and with our governor's office to develop language that it ultimately got passed in that next legislative session. And they developed these posters. I think there were a few others, and stickers and all these other things during the, because we had a big governor's ceremonial signing in the summer, and I loved this one so much. So I took it home and framed it, and it serves as just a reminder to me to support other Black women, femmes, girls, and others. I mean, everyone, but especially Black women, femmes, and girls. But then also myself as a Black woman, I see it and I smile. I get a little confident myself and remind myself to support myself as well. So.
Oh, I love that. Absolutely love that. I think that's the best way to round this up. Well, thank each of you, Andrea, Patrice, LaShonda. I really appreciate you all for taking some time. On that note, we're going to sign off for the day, and we'll be back next month. So thank you all.
Thank you.